right. Well, hello, everyone, and welcome to this session, Pharmacists on the Front Lines of the Pandemic and Healthcare. My name is Libby Ross, and I'm the Senior Director for Student Affairs at the American Association of Colleges of Pharmacy, or AACP, and I'm also honored to serve as a member of the NAHP Advisory Council. This session is intended to give you greater insights into the many ways that pharmacy schools across the country have been actively collaborating with pharmacists and other healthcare professionals to fight the pandemic. Given the important role they play in administering vaccines, providing point-of-care testing, and treating patients with COVID-19, both student pharmacists and licensed pharmacists are in high demand. We hope you will leave this session with a deeper understanding of the contemporary role of pharmacy faculty, learners, and clinicians in supporting public health and patient care. In addition to this webinar, we encourage you to read the March 2021 issue of NAHP Net, which focuses on pharmacy and provides some additional insights into the contributions of pharmacists and the pharmacy workforce. It's my pleasure to now briefly introduce you to our distinguished speakers, Drs. Jennifer Robinson and Julie Akers. Dr. Robinson currently serves as the Associate Dean for Professional Education and Associate Professor of Pharmacotherapy at Washington State University College of Pharmacy and Pharmaceutical Sciences. Dr. Robinson is also earned her Doctor of Pharmacy degree from WSU and began her career at Jones Pharmacy, an independently owned pharmacy, community pharmacy, where she oversaw the delivery of innovative services, including rapid influenza treatment, pharmacy consulting services, and community education classes. During her time at WSU, Dr. Robinson has served in multiple administrative roles and has provided oversight of admissions, student affairs, experiential education, and academic affairs. The focus of her scholarship and research includes expanding pharmacists' clinical roles, leadership development, and mental health. Dr. Julie Akers is an associate professor and director of health outreach and external residency research at the WSU College of Pharmacy and Pharmaceutical Science. She also received her PharmD degree from WSU and was accepted to the GSK Pharmacy Leadership Program in the Wharton School of Business at the University of Pennsylvania. She previously worked as an independent chain pharmacist, pharmacy manager, and district manager. Dr. Akers also serves in numerous leadership roles, including with the Washington State Pharmacy Association, the American Pharmacy Association, and the Board of Directors for a Family Medicine Clinic. She is the faculty advisor for several student organizations and teaches healthcare systems and pharmacy law, among other courses. Her research focuses on increasing patient access to care via community pharmacy. So with that, I am delighted to turn the program over to Drs. Akers and Robinson. Thank you.
Thank you, Libby. It's great to see you all virtually today. And we're really excited to share the response to a global pandemic from the viewpoint of our Washington State University College of Pharmacy and Pharmaceutical Sciences. So really to begin, we want to just start with some background. So first, we're going to start with, what do people think a pharmacist does? So if you all think about your image of a pharmacist, I would say that most people picture a community pharmacist who is really taking pills from one larger bottle and moving them into a smaller bottle. If you ask people really unfamiliar with the practice of pharmacy, what it is, oftentimes this is what their image of a pharmacist is, because that's really all they see in the outpatient setting. So what really does a pharmacist do? So pharmacists are involved in patient care in many settings. In this community pharmacy setting, they prescribe immunizations, they prescribe medications and assess patients for minor ailments and conditions, such as potentially prescribing antibiotics for a bite wound, or they manage burn care for a patient. They perform tests for influenza, strep throat, HIV, hepatitis C, and now COVID. And when appropriate for patients, after those tests, they can initiate them on therapy right away. Pharmacists also work in hospitals. This is usually that kind of unseen role of a pharmacist for most of our community members. They often do rounds each morning with other providers They specialize in areas like emergency department care, intensive care unit, or those NICU units working with neonatal patients. And oftentimes it's a pharmacist who oversees a health system's antibiotic stewardship program. They work in ambulatory care settings. They manage chronic disease states for patients and educate them on the proper self care. They specialize in disease states such as diabetes, respiratory conditions, or oncology, and often oversee admixture of compounded products such as chemo. And really, what is kind of unknown about what a lot of pharmacists do is their work completely outside of patient care. So they are involved in drug supply chain management. They are involved in corporate compliance with state and federal legislation and regulations. They're involved in quality assurance programs, and they do a lot of regulatory oversight. And when you look at the pharmacist patient care process, they really work as part of an interprofessional team with, as you can see from this process, the patient is always at the core. In many states, pharmacists do have advanced scope of practice, allowing them to do care provision that really meets the needs of the patient, especially important in those areas that are considered medically underserved. Oftentimes, the pharmacist is the only or the most accessible healthcare provider for many of those communities. In most states, a pharmacist is allowed to initiate or modify therapy for certain conditions. And not only is the pharmacist the medication expert, but they're highly trained in their curriculum in motivational interviewing and really working with a patient to better understand what their healthcare goals are, and then to develop that care plan with the patient. And having that patient involvement really leads to better adherence and clinical outcomes. And so I am going to now turn it over to Dr. Robinson to move us into pharmacist involvement in pandemics.
Dr. Akers, thank you so much. And I too am excited to be here to talk with you about pharmacy and the role, not only during this pandemic, but how pharmacists for a long period of time have been in a position to save the day. So both Julie and I have I think we have the luck, I'm going to use the word luck, to be able to work at an institution like Washington State University. So for those of you who don't know, Washington State University is a land grant institution. And what that means is that we get the opportunity and we have the focus every day to serve the sons and daughters of toil of our state, so of the state of Washington. This charge came from Justin Morrell. He was a senator in the 1800s who thought that by bringing more education and more service through universities to states across the country, that we could achieve better health, better outcomes, and a better life for all of the residents of each state in the Union. So at Washington State University, we work really hard to do work every day that serves the needs of our community through educating our students, but also engaging with our community to have outreach that is going to be impactful and meet the needs of the community members that we are serving. And so let's take a little bit of a step back. Next slide, Julie, as we talk about kind of where we are now and how we got here with this pandemic that we've been in for a year and a half or so. And so if we look over the past 40 years and look at trends related to infectious disease, something that you will see is that there has been wide global expansion of infectious disease outbreaks. The biggest increases have happened with bacteria and with viruses, and there are several reasons why this is happening. So the first one, antimicrobial resistance. So we have bugs out there that we don't have drugs that are a good match for those bugs. And so there's a mismatch. We're also seeing an increase in the population. So not only do we have more people in the world, we tend to have people who are living closer together and more communally. The third thing, vaccine hesitancy. So more and more people maybe not engaging in the preventative care that we would want them to, that could prevent some of these infectious diseases. And probably the most interesting that you maybe have not thought about what is causing some of these trends related to the increase in infectious diseases is actually the increased utilization of computers and technology to track and respond to outbreaks. So that technological innovation, I think, will be very helpful for mankind, but it's also bringing the forefront of our minds that we do have outbreaks that are happening and we do have a responsibility to respond. So when looking at this graphic that goes from 1980 until 2010, the biggest question you're probably thinking is, what is the future going to look like? And my prediction for the future is that we will likely see more infectious diseases. And as healthcare providers and as pharmacists, we have a role to decrease the impact of future pandemics through community-focused education, proactive prevention, and targeted intervention. So as a college, the pharmacy program and WSU and the pharmacy profession as a whole has been working proactively to address disease outbreaks in a number of different ways. At WSU, this really started in the 1990s, and this was the point in time where we started educating student pharmacists regarding immunization administration. So Julie, next slide. And what this resulted in is the opportunity for our student pharmacists to engage in some really great outreach into the community. And so in the early 2000s, late 90s, you would see our students out there partnering with local health districts or pharmacies to provide immunization, both the vaccines themselves and then education. And then in 2009, we hit a point where the only thing that we were talking about really was swine flu and H1N1. And we had to figure out better and more efficient ways to be able to protect the community from this new variant that was lethal and spread more easily than its predecessors. In the same year, in 2009, our local health district had a 30% cut in funding. So before that year, our health district had a few people who were on board, who were employees, who would work and go out into the community and do some targeted outreach for health-related issues. Well, the health district now had the supplies, they had the vaccine, but they didn't have anybody who was there who was able to actually administer those vaccines. So our student pharmacists and pharmacists in the area stepped in and we were providing vaccinations. And so these pictures are a mass vaccination clinic that happened at our big sports arena in town. So you can see lots of people lining up and then lots of individuals getting the vaccine. During this year, our student pharmacists and the pharmacists that were participating were only able to administer vaccines to adults, so those 18 and older. And so we as a college looked at that and we identified, gosh, there's more that we can do in this space. We really need to train our students so that they're more prepared to give immunizations to pediatrics. And we need to train the pharmacists in the state of Washington so that they're more prepared to vaccinate people regardless of age. So we did that and we integrated that education in. So Julie, next slide. And so fast forward to 2017, and we were facing another outbreak. And as it started with COVID, we were the ground zero for the outbreak again, or I guess this was predating COVID. So maybe we have a history of being ground zero for some of these outbreaks. So I remember in December 2016, I was watching the news with my husband And on the news, it came out that there were 2 positive mumps cases in the state of Washington. And my husband, who is not a healthcare provider, looked at me and said, "How concerned should we be?" And I looked at him and I said, mumps is pretty infectious. And we definitely have some gaps in the people in our community who are vaccinated. So this could become a very big thing. And fast forward to January 6th, 2017, I received a call from my friend who worked for a community pharmacy. And he asked me, he said, we have mumps that's popping up all over our community. We're concerned about schools shutting down, and we'd like to do some outreach so that we can make sure that our school-age children and the teachers are protected and we don't have any interruption to school. Would you partner with us and the Spokane Regional Health District to be able to provide this intervention? And we absolutely said yes. This also came in a year where our county budget, they cut $400,000 from the health district budget. And so there was increased pressure on the college and then community entities, so clinics, community pharmacies, to provide this care to patients. By the time that we had reached 2017, our students had been trained, so we're able to provide pediatric immunizations, and we're very helpful with this outreach. In this year, our students were involved in giving 5,000 vaccines. And in a normal year, the number of vaccines they give is between 1,000 and 1,500. So we looked at this and said, gosh, this is the biggest year we've ever had. I don't think we'll ever see our students giving that number of vaccines ever again. I think I may have spoke too soon. Okay, Julie, next slide. Then in 2019, instead of having mumps, now we were having measles. And again, the impact of measles was hitting our schools hard. There were a lot of gaps in people who were vaccinated, and our students stepped up again, helped out with those outreaches. The outreaches weren't quite as big because of the mumps outreach we had done before. We had better coverage of vaccination rates within our community. We were also seeing other disease states crop up. So hepatitis A was something that was cropping up within specific populations. So we had student groups in coordination with the Spokane Regional Health District who were reaching out and making sure that at-risk populations were getting their vaccines. Julie, next slide. And now fast forward to probably the first quarter of 2020, COVID. And so in just a moment, I'm going to hand it over to Dr. Julie Akers, who's going to talk a little bit more about our outreach and what it looked like with our students into the community. But before we get to that, something that I wanted to talk about is the role of the pharmacist over this last year. I think the role of the pharmacist has primarily been looked at as somebody who has been swabbing a lot of noses to see if COVID is there, or making sure that shots are being administered. But really, it's quite a bit broader than that. So we have pharmacists who are stepping up for the underlying pandemic under our COVID pandemic, which is mental health. We're seeing mental health crises in our communities that we haven't seen before. And our pharmacists have been involved in that, working with patients, connecting with them with care, helping them manage their medications, and when appropriate, triaging them to additional care. And pharmacists have been providing the same type of services for those who have chronic diseases. And so over this last year, it's been challenging, but I'm pretty proud to be a part of the pharmacy workforce that stepped up and made sure that our communities were taken care of. Julie, I'm going to hand it back to you.
Thanks, Jennifer. So you can see that our pharmacy program had a history and unfortunately opportunity to have quite a bit of experience helping with large outbreaks in our community. And then COVID hit. And so as the pandemic hit, pharmacies in our area, just like all the other businesses, had struggles. Many of them had to close or at least close their lobbies. They had to figure out how to do curbside delivery, or if they were fortunate to have a drive-through, how to make sure that they weren't passing the virus through their drive-through. They had supply chain issues. We had pharmacies running out of vital medications and staff that were sick or needing to be home to care for others who were sick, or they were immunocompromised and just really scared, honestly, to come to work. And so our student pharmacists really helped a lot of those companies in our area. They were both hired as interns throughout the summer of 2020, and many of them actually even volunteered to make sure that these locations were operational and patients could still access their needed medication. As medical device companies raced to create the first COVID tests, it was pretty evident to all of us early on that we needed more providers trained and able to go out and perform the COVID tests. We were really fortunate that we have included in our curriculum nasal swab and nasopharyngeal testing since 2015, really originally focused on needing those skills for influenza testing in our communities. But we were fortunate that it's really the same technique for COVID. And so we had several years of our graduates, but also our current students who were trained and ready to go. So in the fall of 2020, despite our courses all being online, many of the WSU students, mostly undergrad students, returned to campus, even though courses were online. And with that return, the small community of Pullman, Washington saw a staggering increase in positive COVID cases and hospitalizations. And their small little critical access hospital really was not prepared to have this volume of COVID cases in the community. So right away, our WSU clinic partner, Range Community Clinic, they were asked during that first week of the semester to, and I say asked, but it was really more like a voluntold, to be on the Pullman campus during that second week. So it's week one. Hey, week two, we need you here Wednesday, Thursday, Friday to do mass COVID testing for our students so that we can try to support our community. Fortunately for us, during that first week of classes is when our second year students, when I'm teaching them how to do the nasal swab and nasopharyngeal tests. So we knew we had one more full cohort of students who were trained and ready to go. So we did end up with a total of 12 students who were able to volunteer over those 3 days. And they ended up providing over $70,000 worth of care. And while they were learning it during that first week, and we were trying to figure out schedules, and they still had classes to attend that Wednesday, Thursday, Friday. So there was all kinds of logistic issues. We also realized that our students who wanted to volunteer that were third year students or fourth year students had been trained that first week of second year, but many of them hadn't utilized it. And really they wanted a refresher. And then some of the physicians and nurses who were going to be assisting at the event, also some of them had never been trained, or it had been many years, and they wanted a refresher. And so I was able to, that Monday and Tuesday of that week, just days before this mass clinic, scheduled 3 different refresher trainings, and really to do some just-in-time training. And I can tell you, very creatively had to both demonstrate and then observe them doing nasal swab techniques via Zoom. I had never in the history of teaching nasal swabs ever imagined not being in person to show someone how to do it and assess them. And so we got really creative with Zoom cameras. Coordinating an event like this with less than a week's notice was absolutely Herculean. But it really all came together and was possible due to those student pharmacists, as at that point in time, both our medicine and nursing students, they were not approved by the university to be able to participate in in-person events. So pharmacy students were the only health professional students even available to go down and help with this event. And I can tell you, in talking to those 12 students who volunteered over those 3 days, they really came away with a true understanding of just how important their profession is in a time of crisis. So then we get to some of the challenges that came with involvement in this task. So how was it that pharmacy was able to participate, but medicine and nursing were not? Um, the university really had some quick decisions that they had to make to ensure that that event could even happen. For liability reasons, early on during the pandemic, colleges were not allowed to organize in-person student events, whether it was part of our curriculum or college organized volunteer events. Our pharmacy students were not okay with that. Many of them were just volunteering on their own in our community, but they really wanted to be able to do something as organized through our program. And so they worked with college and university leaders. I know Jennifer Robinson was very involved in these conversations, really for months and months, all through the spring and summer, pushing and pushing to try to get approval for our registered student organizations to be able to be involved. That way, it's an organized effort, college and university supported. But through those RSOs, or registered student organizations, they have a different liability structure. So we were trying to alleviate some of that concern the university had of, what if we have students attending and they contract COVID? Are we liable? And what are those risks, right? And so there was conversations for months and months. And when the fall 2020 semester began that first week, there was still no approval. But I can tell you at the end of that first week, when it was determined this COVID mass testing clinic was going to be happening the following week, and the physicians and nurses who were going to be there they needed more bodies. They needed people to be able to actually help perform the test and help with workflow and everything else. Never have I ever seen administrative approval within a university happen as fast as it did that week. Quickly got that approval. We were the very first program within WSU to get RSO approval for students to help in person. And really, this event, they wouldn't have been able to pull it off if they had not had those students there. And I can tell you that during that event, the pharmacy students themselves conducted over 450 tests. So then we really moved from the focus on COVID testing to vaccinations. And our community partners reached out to us again as they knew they were going to be receiving vaccine, but they just didn't have the providers to administer it, also to run the vaccination clinics, and also keep their COVID testing sites operational. And so again, it was through these pharmacy student RSOs that we were able to match up our students with our community partners. So with like CVS and Walgreens, who had the federal long-term care facility contracts, with our local health district, with some of the provider clinics in our area, and those community pharmacies who knew they were going to be receiving vaccine, but really needed that manpower support. We're also extremely fortunate in Washington State that we have a law that allows interprofessional precepting at volunteer events. So our pharmacy students could go work alongside physicians and nurses without a licensed pharmacist present. This law was something that was passed just a few years ago, and it was actually spearheaded by one of our pharmacy students, who is now a pharmacist in Washington State, who prior to COVID had seen that barrier at other events like the measles and mumps outbreaks or immunization clinics or other health fairs, where the pharmacy students, if a pharmacist couldn't make it to oversee them, they couldn't participate and help their community side by side with their nursing and medicine students if there wasn't a pharmacist present. So being able to have our students go out and provide both COVID testing and immunizations, regardless of what healthcare provider was there for oversight, absolutely helped make this happen. Eventually, our nursing students were able to gain approval to volunteer at events as well. And then we were able to partner with them and really just expand the number of patients that could be vaccinated in our community. So again, in collaboration with the health district, we realized that there was a true need to get out and immunize our underserved populations as well, our unhoused population and our underrepresented populations. There were focused immunization events that were marketed towards marginalized populations, our communities where there's higher people of color that live in that area who have access to care issues. We had events that were marketed and geared towards the LGBTQ community. We also had events that were for Spanish speaking populations, recognizing that we had significant barriers in a largely agricultural area where English was a second language or English is not a language at all for them. And so having events that were organized in Spanish really was able to increase the number of people in our communities that were immunized. We had events where we knew there was multi-generational housing where people just really couldn't actually get transportation to the large immunization events. And so we were again able to work with our Range Community Clinic that has a traveling bus clinic and get out into those rural areas or actually drive to those housing centers and immunize people where they are. So here, get my slide to go. There we go. So when we think about this as pharmacists, as vaccinators, on top of COVID, you know, if we think about last fall, although we had a light influenza season, many people were still getting that influenza immunization. And so we had, during this time of COVID and COVID testing and COVID immunizations, we had pop-up events for influenza because our students had been being trained in pediatric immunizations for so many years at this point. We also were able to organize quite a few vaccine catch-up events, really to find those children who, due to COVID and families being unsure about taking them to their provider appointments or providers just not having in-person appointments and doing virtual health, there was a huge backlog of children who needed their routine immunizations. And so our students were able to be involved in those. And what I really appreciate, as you can see in the bottom right-hand corner image, even our first year students who are not yet trained in immunization administration, they still got involved. They helped with patient check-in process and just overall workflow. And I think most of us know, again, when we think of community pharmacists specifically, they really have been for over a decade the main provider of immunization, immunizations for influenza for years. And whether it's through community pharmacies, but also our student pharmacists through health outreach events. So all of these years of experience with influenza and measles and mumps, and really being able to quickly mobilize and be able to set up these large clinic events, that really translated to a quick COVID response. And so as soon as that vaccine was available, we were able to use all of that previous knowledge and resources and quickly get up to speed with COVID. There were definitely some unique challenges that came with both COVID testing and immunizations that we didn't have with all of these others. And you can probably notice some of those differences in the images that you're seeing now versus the ones that Dr. Robinson showed with measles and mumps. Access to PPE was really limited early on during the pandemic. And with immunizations, you know, we can't use the darts method from 6 feet away. So social distancing while providing an immunization is just not possible. So our students worked really hard to ensure they were within CDC guidelines and really overcome these barriers. They also spent a lot of time educating and really comforting patients because many of them were struggling between vaccine hesitancy and maybe even vaccine hesitancy in patients who didn't previously have that with other vaccines, but they were a little more hesitant with COVID. And they were kind of battling between this hesitancy, but also that desire to be healthy themselves and to work toward herd immunity. And I have to say, our students faced each and every challenge professionally, but really also with a creative and innovative mindset, and truly did over decades, but especially with COVID, show just what pharmacists and pharmacy students can do to help communities in a pandemic.
So some of our key points and takeaways is that pharmacists, they're really a highly accessible group of healthcare providers who provide services to communities that are in need, and that pharmacists are continually trying to evolve the types of services that they provide and the care that they extend to the community based on the needs of what's going on within that community. And so this could be related to preventative care, anything from family planning to a whole host of immunizations outside of COVID and influenza, and then even travel medicine, where after COVID gets more under control and maybe in a couple months, we'll have more people who are traveling. From a self-care perspective, pharmacists are there so that if somebody has something going on and they're trying to figure out, can I treat this on my own, or do I need to go in and get a higher level of care, that the pharmacist can be that triage point and try to guide people to access care at the lowest level possible to make sure that that individual is getting the highest quality of care at the highest level of value. There's also chronic disease state management, so working with patients, making sure that they have access to their medications, that they're available and affordable, and monitoring the patients to make sure the medications are actually working for them and we're getting the outcomes that they want. And this type of work happens not only in a community pharmacy, but also in clinics and then within hospital settings as well. And last but not least, treatment of minor ailments and conditions. And we do that through point of care testing, some of them that we've talked about today. There's some of the rapid infectious disease tests. So rapid COVID, rapid strep, rapid influenza. We also have the ability to have tests that are point of care that are related to chronic disease states. So doing cholesterol tests or blood glucose tests, or even simply just taking a patient's blood pressure and giving them feedback about how well their medications or maybe their lifestyle interventions are working or maybe not working. So with that, we're going to wrap this up. And on behalf of Julie and myself, we want to thank everybody who came and listened to our presentation. And now I'm going to hand it back to Libby, who is going to open it up for questions.
Great. Thank you so much, Drs. Robinson and Akers, for sharing your incredible insights into how you and your pharmacy colleagues and students coped and responded to infectious diseases, including COVID-19, and have made a difference in so many lives. For all of the advisors, and I just realized I don't have my video on, for all of the advisors who are in the audience, we do hope you have a better appreciation for the critical role that pharmacists provide in terms of providing direct patient care and supporting the public health in both the pre and post-pandemic world. And as mentioned, we would love to have take any questions that you may have about the pharmacist's response or about the vaccination efforts or anything like that. So you can either enter your question into the chat box, or you can raise your hand and we'll call on you so you can unmute yourself. So there is a question from Oscar in the chat. Says, thanks to both of you for these highlights of the pharmacy career. I wonder how many of your curriculums have evolved to meet these new challenges in the way that you train pharmacists?
I can take that one. Oscar, thank you so much for that question. So with our curriculum, we actually see it as this living, breathing thing. And we continually work really hard to keep track of what's happening within our local community and then the national community. So are there trends that are cropping up that there are specific disease states that need better care? Are there gaps there that a pharmacist could help fill in? And as we identify those gaps, then we think, okay, what are innovative ways that we can approach these problems and that we can teach our students to approach these problems so that our communities are better served? That's one way that we do it. We also get feedback from lots of stakeholders who are currently in the community who say, hey, this is education that we believe would really be valuable for your students. Can you integrate this within your curriculum? And then we integrate it within our curriculum. The third way probably that we integrate things within our curriculum is through the research that our faculty are engaged in. And so Dr. Akers, I think, is a perfect example of this. She is one of the pharmacists in the state of Washington who spearheaded providing education to community pharmacists to be able to treat minor ailments and conditions in the community pharmacy setting by having pharmacists prescribe a limited number of medications for conditions that patients could identify on their own. And so sometimes the most creative ideas come from our faculty, and then the research shows that they're effective, so we integrate them right into the curriculum. So Oscar, thank you for the question.
And Jennifer, it looks like there's another question that you might be able to think of some resources. And while you're thinking about some resources to answer Lena's question, Oscar, I'll just add some of the specific things. So Jennifer Robinson mentioned during the presentation that, since the early to mid 90s, we had already put into our curriculum adult immunization administration training, and quickly realized that we needed pediatrics. So we were one of the few programs around the country that actually created our own pediatric immunization training, and that's been embedded in our required curriculum for many, many years. And that program actually was just due to COVID and the CARES Act and PrEP Act and the things that came out with that. Two programs that were developed within our WSU College of Pharmacy and Pharmaceutical Sciences by some of our colleagues, both technician administration training and pediatrics, have both been partnered now with APHA so that they can take our programs and really expand access to it nationally and really globally through APHA. So we're excited that something that we recognized, almost a decade ago and built it and designed it into our required curriculum is now something that's being utilized at a large scale level. We also recognized when the CDC came out and said, that baby boomer population, everyone born between 45 and 65 needed screened for hepatitis C. I happened to at the time be doing research on hepatitis C as well. And we already had our curriculum where we were teaching immunizations and throat swabs for strep throat. And we, at that point, had added in the nasal swabs for immunizations. And we recognized that Hep C and HIV were two areas specifically where outpatient pharmacists were being more involved in screening populations who were at risk. And then once you find those people who are screening antibody positive, you can then refer them into healthcare systems for more advanced testing and confirmatory testing. And so that has been embedded into our curriculum. And then, as Dr. Robinson said, as we were moving towards really, especially in areas where patients have access issues to care, or they're utilizing what could be considered inappropriate sites of care. So a woman with an uncomplicated urinary tract infection. If you're a woman and you've had one, you know what it is and you know what you need, right? And so, but many were going to urgent care centers or emergency departments, really significantly increasing cost of care simply because they maybe couldn't get off work to go to their primary provider. They didn't have a primary provider, or, really had transportation issues. And we realized that those community pharmacists, and especially those small pharmacies out in rural areas, are oftentimes the only healthcare provider. And so going through and getting them to be able to feel confident through some refresher trainings. And also, thankfully, our state does have a pretty broad prescriptive authority, delegated approval in our state, to get them to where the patient can go into the pharmacy, the pharmacist assesses them, and if they do need that antibiotic or some other prescription therapy, the pharmacist can just prescribe it instead of saying you have to drive 20 miles into town and it might be a week before you can get an appointment with a provider. Just let the pharmacist be the solution for that patient. And so that is actually, all of that training is embedded into our required curriculum as well. And we have faculty who are very involved on the research side, but also in practice in a lot of different organizations and associations. And so we're always kind of staying at the forefront of what's new, what's next, what's happening, where are the gaps in care. And then we come back, and our faculty are great in our faculty meetings at saying, hey, here's where gaps are. Here's what we think we could do to train our students. So as future pharmacists, they're ready to provide the solution for that. And actually have those conversations about, should we educate students with this information? Should it be an elective? Is this something that every graduate needs to have when they graduate and become licensed? And that's really how I would say our curriculum continues to evolve. And we're always looking at what's next and how do we integrate it. And Jennifer, I see you put some links in there if you wanted to talk about those.
Right, so Libby was the one who actually put the link in there. So Libby, thank you for putting the Pharmacy for Me link. The Pharmacy for Me, it's a great resource that students can use. There's a quiz in there to see if pharmacy might be a good fit for them or not, or maybe a different direction. And so with students, provide them with that link, provide them with that information as just an entry into, could pharmacy be right for me? Beyond that, I would encourage, if you have any interested students, to have them reach out to a local college or school of pharmacy to ask more questions and to investigate if pharmacy is the right fit. And then an additional thing that students can do is actually reaching out to people within the community who are practicing as pharmacists. This can get a little bit tricky because I think there's this view that pharmacists are just in a community pharmacy setting, which is my background, and I adore community pharmacy, but there are a lot more different areas where pharmacists work. So that includes hospital settings, clinic settings, and then some really interesting niche settings that are also available. So encourage students to do some research, but most importantly, get out there and talk to people and see if the fit is right.
Perfect. Well, thank you again, Dr. Akers and Jen Robinson, for taking the time to share again your insights and perspectives and expertise. I want to invite everyone who has, if you have any additional questions, to feel free to either reach out to AACP at farmforme@aacp.org with any questions, or to visit our virtual booth this afternoon as part of the WAH conference. So thank you all again, and thank you to our speakers, and we hope you enjoy the rest of your conference. Thanks, everyone.